So you're about to go on a contraceptive pill for the first time and you would like to know what contraceptive pills are bad for you, or which contraceptive pills should you avoid, or which are the contraceptive pills that might give you the highest risk of blood clots or stroke, and that depends on your risk factors, which I'll discuss much later on. For example, you might have risk factors such as a family history of DVT, also known as deep vein thrombosis, and you're told that you cannot take certain contraceptive pills. Now, we all know that your standard contraceptive pill contains your progesterone and estrogens, which is basically for the main purpose of stopping your periods, as well as to prevent you from getting pregnant. However, there are two specific contraceptive pills that are different from your standard contraceptive pills. One is called Dianette and the other one is called Yasmin. Now, unlike your standard contraceptive pill, Dianette, for instance, contains what we call an anti-androgen hormone called criproterone. Now, criproterone has found to be quite useful in the symptoms of acne, excessive hair growth, as well as oily skin. So criproterone is usually combined with the estrogen called estradiol in Dianette. Now, Dianette already has a high content of estrogen as well as the high content of androgen called the criproterone. So therefore, a combination of these two components make Dianette a very high risk contraceptive pill in terms of you are higher risk of blood clots if you take Dianette. Now, if we look at Yasmin, Yasmin also contains estradiol, about 30 micrograms, and is also combined with a synthetic progesterone called drospirenone. Now, drospirenone belongs to similar classes such as your desogestrel, which are also known to be higher risk, but drospirenone in particular has a higher risk than other progesterones. And again, a combination of drospirenone and your estradiol is known to have a higher risk of blood clots similar to the Dianette. Now, a lot of women would swear by these pills. Dianette and Yasmin are wonderful. And why are they wonderful? Well, they're wonderful because of the effects they have. For example, these pills are known to be very effective treatments for polycystic ovarian syndrome. Now, polycystic ovarian syndrome can present with symptoms of acne, excessive hair distribution, weight gain, and irregular periods. So a lot of women take the combined pills just for this purpose. Also, these pills are very effective for acne without symptoms of PCOS. They're also effective for very oily skin. A lot of women will say once they started taking the pills, had clear, amazing skin. They're also known to regulate your periods for women who suffer from irregular periods, and you might not need to have polycystic ovarian syndrome to go on this pill. However, as I mentioned, this pill are not without its risks, and I've mentioned the risks of blood clots. We're talking about DVT in the legs and what we call pulmonary embolism in the lungs, as well as risk of having a stroke, and it can cause other cardiovascular events such as heart attacks, as well as severe migraines. I mean, in terms of side effects, you might find that they have standard side effects like your other combined contraceptive pills, such as, they can cause, again, headaches, they can cause nausea, weight gain, bloating, mood swings, and a host of other symptoms. Now, if we were to look at the risk factors, what are the risk factors of not being able to go on the pill? So if you have any of these risk factors, your doctor might advise you not to go on either Dianette or Yasmin. For example, if you have a BMI of over 35, which means you're overweight or obese, if you're over the age of 35 and you smoke at least more than 15 cigarettes a day, if you do have a family history or personal history of any of stroke, blood clots in the lungs or in the legs, as well as a personal or family history of breast cancer, if you've had severe migraines or migraines with aura, or if you've had recent major surgery, you're advised that it's not wise to go on any of these pills. Like I mentioned, these pills are not really given for the sole purpose of contraception, so they're not usually the first choice of contraception if you see the doctor. So for example, a 30-year-old woman comes in to see the doctor and says, look, I want to go on a contraception because I have heavy periods. The doctor is not going to offer you Dianette or Yasmin as a first choice. They're most likely to offer you other combinations of the combined pill, such as maybe Migraine or Celeste. In terms of the safest pill to take, it's usually advised that levonorgestrel-containing pills are the safest to take in terms of risk of blood clots. So for example, if you took the Dianette or the Yasmin for the purpose of acne or irregular periods, it's normally advised that you should be on this pill for at least not more than 2 years, just because the longer you're on the pill, the higher the risk of you having any of these risks. So if any of you have been on this pill for longer than necessary, I would advise you to go to your doctor and they should consider whether you need to remain on the pill In this case, you're happy to take the risk, and that's if the benefits of taking the pill outweigh the risks, and also if you've got no risk factors for which you should not continue to take the pill. Otherwise, you might have to consider other methods of contraception, such as going on an alternative combined pill, or long-acting pills such as the Mirena Quell, for example. You've got the injections, and you've got the implants. Now, if you have any further questions regarding Dianette or Yasmin, please feel free to drop some comments. And you can check out my playlist on women's health for further similar videos.